Hi, I'm Dr. Tran with Midtown Dentistry in Houston, Texas, and some of the questions that I get asked the most are regarding fillings and crowns. And so in the rest of the video, I'll be answering some of those questions for you. Generally, you need a crown when the tooth has broken down a lot or the cavity is so big that the majority of the tooth structure is gone. And so at this point, we can do a filling on that tooth, but because there's more filling material than tooth structure, it's not quite as strong as it once was in the past. And so, it will work, it will do its job, but a crown is a much better option in that case because it provides a full coverage protection for the tooth and it will last a lot longer also. So there's nothing more involved in it for you. The appointment is more or less the same. You come in, you sit in a chair, we make sure that you're nice and numb so that you don't feel anything during the procedure. I mean, you'll be awake, you know that we're in there, you know that we're doing something, but you're nice and numb, and so we'll essentially prepare the tooth for a crown, take a nice impression of it so that the lab knows what it looks like inside of your mouth, and then they'll hand fabricate and design the crown, custom shape it and match it so that it'll blend in seamlessly inside of your mouth. And then once we get that from the lab, we'll cement it back in, make sure that it feels good, you can floss between it and everything's okay. And then other than that, you're good to go. And the maintenance on the crown is no more than what we recommend already for you, which is brushing twice a day and flossing at least once a day. You don't need to prepare for it, there's nothing you need to do extra going in to get a crown done. It's just like a filling, it's almost like a cleaning essentially also, but other than the fact that we do have to numb you up to make sure that you're comfortable during the procedure. It's definitely not going to hurt. We'll always make sure you're numb so you don't feel anything that's going on, and so you don't have to worry about it. If you by chance do feel anything during the procedure, just let us know. We can always make sure that you're comfortable throughout the entire process. So a crown generally lasts 20 plus years. It really depends on how well you take care of the crown also. If you're just leaving bacteria, food all over the place, then you're at much greater risk of getting a cavity around the margins of the crown also. But if you're taking really good care of it, you're coming in for your checkups, there's nothing more that you have to do. Filling will do the trick, it'll do the job. We'll remove the cavity and essentially fill the tooth back up with a filling material so that it's nice and healthy again. But especially on your back teeth, when you're eating, putting a lot of the forces on the tooth, it is more prone to cracking and chipping and breaking off, just because it's not one piece, it's not as strong as it once was in the past. But if the filling is small, and you have way more tooth structure than you do filling material, then I would never recommend a crown in that case. We would just remove the cavity from the tooth, put a filling material back in there, and just make sure we keep everything nice and clean. You don't always need a crown, but in certain cases, it is recommended because of the amount of filling material to tooth structures that you have left. Alright, so I hope I answered some of the questions that you had, and I hope that it makes sense also. But if you're ever in doubt whether you need one or the other, don't hesitate to ask us, I'll be happy to answer your questions for you. Or for more information, be sure to visit us at midtowndentistry.com.